Welcome back. Today we are joined again by Justina Adangai, a family nurse practitioner at Omni Family Health. We're going to be talking about some of the common myths and facts surrounding diabetes, a condition that affects millions of people. So whether you're looking to learn more about managing diabetes or just curious about how to stay healthy, this conversation is for you. Welcome, Justina.
Thank you. Thank you.
It's so great to have you back.
Always great to be back here.
Okay, we are wearing the color of Diabetes Awareness Month. I think mine's close, not quite. I'm close. So let's explain to our viewers what exactly the condition of diabetes is.
So in a simple, I'll just say diabetes is where blood sugar, or sometimes called glucose, we have a high level of that in the bloodstream. And there are different types of diabetes, and so sometimes either your body is not utilizing insulin well, or the body is not producing enough insulin, or the body is just not producing it at all. So that causes kind of like an oversaturation of blood sugar, and so then we do have what is called diabetes. And it would interest you to know that we have about 38 million people in the US right now with diabetes, and over 413 billion is being spent in diabetes care and management as of 2020.
So can you explain the difference between type 1 and type 2 diabetes?
All right, so type 1 and type 2, with type 1 is autoimmune, and that is where your body is not producing insulin or producing very little. So those people need insulin to live on a daily basis. Type 2, on the other hand, is either the body is producing little insulin or your body is not utilizing that insulin well. There's some insulin resistance, and that comes with a lot of other risk factors that causes that to happen.
So let's go into our first myth or fact, Justina. Is it me being overweight, is that going to make me automatically get diabetes?
That will be a myth, but it is a risk factor to developing diabetes.
Okay, another myth or fact, Justina. If somebody has diabetes, do they have to completely avoid sugar, or can they manage it into their life and their health?
I believe that's a myth as well. It is also a risk factor. So consuming sugars over a long period of time. And when we talk about sugar, we're not just meaning just regular sugar. It could be a lot of carbohydrate because it turns into sugar and glucose in our bodies. So over a period of time, it can put you at risk to develop diabetes.
So that pulls us into our next myth or fact, Justina. Is eating sugar or a lot of sugar or carbs going to lead me to get diabetes?
Myth.
but
it is also, like I said, a risk factor. So a lot of times we need to know our risk factors and what could predispose us to developing diabetes, right? And things like consuming a lot of sugars could cause that to happen, but in fact on its own doesn't cause diabetes.
I have a sweet tooth, so that makes me happy to hear.
And the holiday season.
Oh, I know. Goodness, so many carbs during the holiday season.
Yes.
So if no one in my family has diabetes, does that mean I'm not going to get it, or can I still get it?
That is a myth. But
there's a lot of myth buts today.
There is a lot of it. So when you have a family history of diabetes, it puts you at risk, about 20 to 40% risk factor. But if nobody has diabetes in your family, that does not mean you're not going to get it at all, because we have other environmental factors or other things, like I said, sedentary lifestyle, what we eat, and things like that can cause you to have diabetes, and obesity, of course. But being that you don't have anybody that has it in your family does not give you like
a free pass.
Yes, it does not.
So let's talk about treatment. You said 38 million Americans live with diabetes every day. Yes. So what are the types of treatments we have? Is insulin the only treatment we currently have for diabetes?
With people that have type 1 diabetes, unfortunately, insulin is the only treatment for them at this time. For people with type 2, however, some can use insulin to get better control of their blood sugar. We have other oral medications. We have injectable medications that people can also use. But especially with type 2, lifestyle modification, lifestyle changes is the key, is the biggest. Staying active, low carbs, what you put in your mouth. moving around, not just sitting and binge watching and stuff all the time. Those are bigger things that really can help with diabetes and even set people in remission with type 2 diabetes.
I've heard of that before,
Yes.
people going into remission just by changing their lifestyle.
Absolutely. It used to be considered chronic and progressive, but now with more research and people even being more aware of everything, we know that it can absolutely be reversed with some changes and lifestyle changes.
Well, that's good news. I like that. I like to hear that one.
News.
All right, Justina, if people want to get more information on diabetes or diabetes management from you or anyone at Omni Family Health, how do they do that?
I want to say that November is National Diabetes Awareness Month. This is a time where we give awareness, education, support, advocacy to people living with diabetes, to friends, families, and support system of people living with diabetes. So at Omni, we have over 40 clinics in 4 counties. You can either stop by one of our clinics, make an appointment. You can go to our website, www.omnifamilyhealth.org. You can call our 800 number or even send a text message, and we have social media pages as well. That you can also get some information there as well.
I love it. So many ways to get all the information.
No excuse.
Exactly, that's what I was going to say. You took the words right out of my mouth. Well, thank you so much for being with us today. And this is the time to learn diabetes awareness. Let's do it.
Absolutely. Thank you.
Thank you. We'll be back with more Studio 17.